Okay, this video is called How to Make a Medical Mnemonic. Mnemosine was like this Greek goddess of memory. Acronym is pretty much the same thing. Basically, you take the first letter of whatever it is you're trying to remember, and then you make them into a word. So this is a mnemonic for ring-enhancing brain lesions on brain MRI. One of the things I do is I'm a neuroradiologist. So I'll see many thousands of brain MRIs, and sometimes I'll see a ring-enhancing lesion. So the mnemonic for that is Magic Dr. L. All right, and then each letter represents one disease. M for metastatic tumor, A for aneurysm, G for glioma, primary brain tumor, I for infection, thing like a brain abscess, toxoplasmosis, that sort of thing. And then what you do is once you know the name of the thing, you can add little clues that would enable you to differentiate it. For example, the brain abscess is going to be positive on DWI, diffusion-weighted imaging. Okay, C is cystic sarcosis, which is also an infection, but it's kind of a unique type of infection, the porkworm. D for demyelinating disease, which is just one more name for typically multiple sclerosis, but it can also be ADEM, acute disseminated encephalomyelitis, okay? R for two things, radiation necrosis, resolving hematoma. I'll show you some pictures in a moment, but I'm just showing you, these give you a link. In a sense, they chunk it all together, so all you have to remember is Magic Dr. L, and it becomes very easy to derive from that these different things. The L is for lymphoma. Okay, so let's just look at a couple slides here and see what this stuff looks like. Okay, first of all, here's brain MRI. Brain MRI is really all about a few things. First of all, T1 and T2 are the fundamentals of brain MRI. On T1, fluid is dark. On T2, fluid is bright. And that's like saying animal kingdom, plant kingdom in zoology. You have to know that. It's the most important thing in all of MRI. On T1, fluid is dark, and on T2, it's bright. I sometimes remember 1 is like the straight vertical line for the letter D for dark, and 2 kind of looks like a rounded on top, like a B for bright. That is the most important thing. And then you're going to use T1 to give IV contrast because you want a dark background. MRI is always about making the pathology, the abnormality, look bright, and the normal tissue just to fade out in the background so it doesn't distract you. Okay, so now I'll show you some cases. Here's a patient who's got 2 simultaneous lesions. Whenever you see multiple simultaneous lesions of ring enhancement means that the IV contrast is leaking out into the brain tissue, the brain parenchyma, and that's because there's a breakdown of the blood-brain barrier. Okay, normally it should not leak out at this location. So you've got 2 ring-enhancing lesions simultaneously. As soon as you see 2 lesions, the first thing you should think of is metastatic disease, because metastatic disease means spread of cancer from another primary site. And that's because metastatic cancer to the brain is relatively common. It's still not that common. I mean, I work as a neuroradiologist, and I'll see 1,000 strokes in one day because many patients have like 100 of them, all right? But I usually only see, one patient with brain mets every week, okay? So strokes are thousands and thousands of times more common than brain metastases. Okay, I'm pretty aware of brain metastases in my job, and my mother died from them, okay? So I'm pretty aware of them. But anyways, multiple simultaneous lesions, it's usually going to be brain metastases. Now here is a single lesion with a thick irregular wall, and that's a very characteristic appearance for a GBM, glioblastoma multiforme. Glioma means primary brain tumor. So that's what they look like. Now, here is another example of something a little bit more unusual. Here's a brain abscess. And you've got the ring enhancement on T1 post-IV contrast MRI. You can tell it's T1 post because you got contrast in the superior sagittal sinus over here. You've got a low T2 signal rim as well as adjacent vasogenic edema. That's all characteristic of an abscess on a T2 brain MRI. Central low T1 signal on the T1 sequence, characteristic. Now this is DWI, diffusion-weighted imaging, and that has hyperintensity, high bright signal in the center, and then it restricts, means goes to low signal on the ADC map. So this is typical of a brain abscess, like a pyogenic brain abscess, a bacteria brain abscess, okay? And those are the little nuance things to remember. So the mnemonic gets you to remember infection, and then you have to know the little details. But it's relatively easy to attach the details if you know the main mnemonic. Okay, now here's a patient who had multiple sclerosis, and they've got a characteristic lesion called Balo's concentric sclerosis. Concentric rings are noted on the T2 sequence. On the ring enhancement, it's actually an incomplete ring, and that is characteristic as well of demyelinating disease like multiple sclerosis. It is not hyperintense centrally on the DWI, so it is not a brain abscess. And then there's a little vein that can be seen in the center on the SWI, susceptibility weighted image. This is classic for multiple sclerosis, okay? All right, I got one more lesion here. I think this is my last slide. This patient has this big lesion in the left parieto-occipital area, and there's some ring enhancement, okay? And you see that ring enhancement, you're like, well, gee, is that a tumor? Is that a glioblastoma multiforme? At this point, it certainly could be. It's got a very sort of thick, irregular wall. However, when you look at the adjacent image at the gyriform enhancement, of the cortical ribbon of gray matter, you can see it follows the cortical ribbon between the sulci and the gyri, and that is a classic appearance for subacute infarct. So I would be able to tell that this is just an atypical resolving infarct, subacute infarct, with the tip-off being the subacute enhancement, which is usually positive from 6 days to about as long as 6 months. So anyways, that's how you differentiate ring-enhancing lesions on brain MRI. But the point of this lecture was you make the mnemonic because from the mnemonic it enables you to rapidly derive the differential diagnosis. And then you have to know the little nuance to subtype out the different causes of the featured lesion, in this case ring enhancement. I do have hundreds of these mnemonics for all the different diseases I memorized when I was in residency and fellowship. However, many of them are pretty boring and dry, so I don't think I'm going to go through those. I don't want to bore the audience, but at least you know how to make them for any time that you need to make them. And if I have any other one, at least this ring-enhancing brain lesions was a little bit interesting from a pictorial aesthetic sense of view. So anyways, I hope you found that interesting.